Good evening. This evening, I wanted us to continue from this other topic. Last time we had heart failure, and this time we want to continue with the different kind of drugs that help us in the management of heart failure and also hypertension. So basically, we are going to look at antihypertensives, and these are drugs that help us in the management of hypertension. So blood pressure equation, I just want us to look at first our objectives. The first objective is basically for us to define what antihypertensive agents are, and then also to describe the mechanism of blood pressure regulation, then the categorizing the antihypertensive drugs that are based on the specific targets that they act upon, because every drug has its specific area where it has to cause its effect. So we need to understand that the different types of antihypertensives, they have the different areas in which they always have to act or cause their effect. Then also we have to explain the modes of action of antihypertensive agents. How do they act? In which way do they actually try to cause an impact in order to reduce or to lower the blood pressures? So in arterial blood pressure, I want to say that the heart's primary function is basically to circulate blood to nourish organs and tissues throughout our bodies. We very well know that our bodies get our nutrients, oxygen, and other elements from the blood. So when the heart fails to actually supply our bodies with the necessary blood that is expected for them to pick the nutrients from, then we can get some other issues or some other complications or diseases. Then also during the systole, the heart contracts, that is pumping blood from the right ventricle to the lungs and from the left ventricle to the rest of the body via the aorta. So our bodies receive blood from the heart, and it's basically the the right ventricle pumps blood to the heart, to the lungs, and it's from the lungs where our blood is being oxygenated and is sent back to the left ventricle where the blood is pumped, and that is now the oxygenated blood through the aorta to the rest of the bodies parts of their body in order for us to get the nutrients and the necessary oxygen. Then also the force of blood that is ejected or that is pumped from the heart is also known as arterial blood pressure or systolic blood pressures. So during diastole, the heart muscle relaxes, causing blood pressure to decrease to diastolic levels. So during the diastole, that's when you're measuring the blood pressure, you always realize that the top figure or the top number is what we call the systole, and then the lower one is the one that we call the diastole. So the lower one is always less than the above one, meaning the diastole is always lower than the systole. So blood pressure readings are typically recorded as systolic pressure over diastolic pressure, which I already mentioned. For example, here they are showing us that the systole is 120 and the diastole is 80 millimeter per mercury, meaning this is somebody's blood pressures readings that have been taken, and they have realized that the person has the systolic of 120 and the diastolic of 80. Pulse pressure, the difference between the systolic and the diastolic pressures reflects the elasticity and tone of the arterial blood vessel walls. So basically the blood is passed through the blood vessels, and when it passes through, there should be a way in which these blood vessels have to relax, constrict and relax in order to release the blood. So when they constrict, they are actually trying to push the blood. So the elasticity of the blood vessels is very important so that it can be able to actually push the blood out of the along the blood vessels, so that it can be able to reach in all the parts of the body. But if there is poor elasticity of our blood vessels, that means there will be resistance and the blood will not be pumped to the rest of the body. So let us see also about the mean arterial pressures. What does it mean? So for the case of the mean arterial pressures, it represents the average pressure throughout each heartbeat cycle. So the heartbeat cycle is basically receiving and pumping it out. That is a complete cycle. So it is also crucial for driving blood through the circulatory system to effectively perfuse organs and tissues. So the blood is brought into the heart from the lungs and again from the heart back to the rest of the body. So that will be a complete cycle. If the blood is not oxygenated and the blood is not pumped out of the heart, then there will be a problem in our bodies, which is not actually good for any individual to experience such. So tissues, the mean arterial pressures can also be calculated using a specific formulas or by adding 1/3 of the pulse pressure to the distal pressure. So you just add and you'll be able to understand that this person's pressures have either increased or they have lowered. But sometimes people take only pressure once, and when the pressures are high, they just say that this person has high blood pressure. But you're supposed to take it at least 3 times when somebody is at rest. And then if it is persistent, then you just know that this person's pressures have shot high and this person has high blood pressure. So the normal mean arterial pressure readings typically fall between 70 and 110 millimeter mercury, and a target of 600 millimeter mercury or higher is considered adequate for optimal organ and tissue perfusion. So if it is very high, higher than this, then someone may be actually having problems with the perfusion of his organs and tissues. Or if it is much more less than this, then also the person will be having problems in perfusion of his tissues and organs. So arterial blood pressure remains within a narrow limit under typical conditions, and it may end up peaking during activity and lowering during sleep. So when someone is very active, also the arterial blood pressures rise because the body is actually trying to help in engaging someone in the activities. You remember when someone is maybe doing an exercise, he needs a lot of energy, and for that reason the body also has to actually to adapt, whereby the heart will be able to pump blood very fast in order to sustain the activity which that person is actually performing. But if the person is at rest, then there is no need of the heart to also increase in its rate of pumping the blood throughout the body, because the person is at rest or the person is sleeping. So there is no activity and there is no need of a lot of energy for someone to perform nothing but when he's just sleeping. So energy needs a lot of arterial pressure that will increase in order to sustain or to help someone perform the activities that he's doing. So we also want to understand the factors that are influencing arterial blood pressures. What could be the factors? One of them is arterial blood pressure is actually determined by the interaction of the cardiac output and also the peripheral vascular resistance. So in case the person's cardiac output is low, that means the person will not be able to actually receive enough blood or enough oxygen and nutrients to the rest of the parts in his body, whereby this will be actually depriving the body from the nutrients and oxygen, which will end up causing some other negative impact to someone's life. Then also when there is a lot of peripheral vascular resistance, this is also a problem, because the blood will try to force itself through the resistance of the blood vessels, and by that there will be increased pressures, and this will raise the blood pressure of an individual. And then also the cardiac output can be influenced by the stroke volume, heart rate, and the venous capacitance. Primarily affects the systolic pressure. So the cardiac output can also be influenced in several ways, and they say the stroke volume, that is the amount of blood that is pumped within 1 minute, and also the heart rate. If the heart rate is very high or it is very low, it will also affect the cardiac output. So all this can contribute in the cardiac output of an individual, which will affect the perfusion of the other parts of the body. And then we also want to talk about the peripheral vascular resistance, which is regulated by the arterial constriction and dilation, mainly influences the diastolic pressures. So these are peripheral vascular resistance. For it affects more of the diastolic pressures, and you see that the diastolic pressures are basically the lower pressures. When you take the blood pressure, the one which is below, that is the diastolic. So when you look at the peripheral vascular resistance, it will always affect the diastolic pressures, which sometimes, if there is a lot of resistance in these peripheral vessels, it will cause a lot of pressures, which will raise the diastolic pressure, and at the end of it all, the person will be having high blood pressures. So what do we look at in our blood pressure equation? Our blood pressure equation is basically the blood pressure, which is equals to the cardiac output and times the systemic vascular resistance. Then you'll be able to get the blood pressure equation. So when you look at this and you're able to get the cardiac output times the systemic vascular resistance, that will give you the amount of someone's blood pressures. So the cardiac output, which is CO, that is basically the volume of blood that is pumped by the heart per unit of time. So when that blood is pumped around that time, then you can call that a cardiac output, the amount of blood that the heart is able to pump at a specific time. That is the cardiac output. Then the systemic vascular resistance, the SVR, that is the resistance that is encountered by blood flow in the systemic circulation. Systemic circulation is just basically throughout our bodies. When the blood is pumped through the body, entire body, that is systemic circulation. So the resistance that is encountered by the blood when it is passing through those different blood vessels in our bodies is called the systemic vascular resistance. And vascular basically is the blood vessels. So the passage of the blood through those blood vessels, and there is resistance for it to pass through, is what we call the systemic vascular resistance. So when you want to get the blood pressure, you get the cardiac output, that is the amount of blood that the heart pumps within that minute. Then you multiply it by the systemic vascular resistance, then you'll get the blood pressures. Therefore, any change in the cardiac output or systemic vascular resistance can affect the blood pressure. So if the cardiac output, the amount of the blood that is pumped out of the heart, is actually maybe little, then it will affect the resistance or the vascular resistance in all the vessels around our bodies. Then if the cardiac output that is pumped, the blood that the heart pumps out of it, is also maybe too much, then it will also affect, because this blood will also cause a lot of pressure through the blood vessels, and when it causes a lot of pressure through the blood vessels, it will also cause a lot of resistance, which will affect the entire systemic vascular resistance in our bodies. Hence, it will be affecting our blood pressures. But then the normal blood pressure is supposed to be around 120/80 millimeter mercury, whereby the 120 is basically the systolic and then the 80 is the diastolic. So when someone has this kind of pressures, 120/80, it's actually the normal range of pressures that an individual is expected, especially the adults. So I want to define what hypertension is. So we need to understand what is hypertension, and I believe most of us have ever encountered patients with hypertension. And when we encounter patients with hypertension, we should always be able to understand what hypertension is, how an individual is presenting, and what you expected in order to manage a patient with hypertension. So most of the time we get the the elder patients who have hypertension, and we may not be able to handle them, not because of anything, but maybe we don't have the knowledge, or we don't have the understanding on how to use the drugs. So hypertension or high blood pressure, sometimes people call it high blood pressure, is basically a medical condition that is characterized by elevated levels or pressure within the arterioles. So these pressures can actually increase beyond the normal, and we mentioned the normal is 120 out of it can be from 60, 70, 80, that is the range. So when it is actually above that, then someone can be categorized to be having high blood pressures. So it also affects both the systolic blood pressure when the heart contracts and the diastolic blood pressure when the heart is at rest between beats, or both. So this can happen whereby maybe the diastolic raises or the systolic raises, or both of it can even be affected, and you see the systolic pressures are elevated and also the diastolic pressures are elevated. So this can cause someone to be having hypertension in relation to raising of all the ranges of these pressures, both the diastolic and the systolic pressures. So hypertension can be diagnosed when blood pressure consistently exceeds the thresholds, often defined as systolic pressure above 130 mm mercury and or diastolic pressure above 80 mm mercury. So when someone has the systolic pressures above 130 and the diastolic above 80, then someone can be categorized to be having actually high blood pressures. So we also have complications, just like any other condition, whereby if someone has a condition, it complicates somebody's life. And we want to look at also the different complications of hypertension. So here we have angina. And angina is basically at times also called the heart attack, whereby the patient feels pain, a very sharp pain on the left hand side where the heart is located. Then a stroke can also be one of the complications, where our patients end up having paralysis on the other side of the body. It can be both the upper limbs and the lower limbs, or it can be only the upper limb and the lower limb, and it always happens on the side where the brain is normal. So you realize that maybe there is a problem on the right hand side of the brain, but the effect will be on the left hand side of the brain, whereby now the person will be having actually the effect on either the limbs, both of them, or it will be just a one, the hand or the leg can be paralyzed. But in most cases, our patients have always presented with both the leg and the hand are all paralyzed on one side, and maybe even the mouth is bent on that very side, and that will be categorized as stroke as a complication from hypertension. Then heart failure. Heart failure is also one of the conditions that has actually been caused by hypertension, and has complicated and even caused death to most of our patients. Then renal failure is one of them, because when the heart fails to pump enough blood to perfuse the kidneys, our kidneys end up failing, and is not something that is very simple, whereby people fail to pass urine and they get acute kidney injuries, and this one can actually lead to multiple organ failures, and we lose these patients. Then retinopathy is basically in relation to the retina, where there is increased pressures. Sometimes when the blood vessels in the retina can end up rupturing, and we lose our sights in relation to hypertension. So I want us to look at the classifications of hypertension. The blood pressure is basically in millimeter mercury, and then also I want to look at what happens if it is normal, what are the ranges of normal, and how do we manage such a patient. Then also if it is elevated, when do we say it is elevated, and what do we do? When we say it is not stage 1 hypertension, that is what range, stage 2 hypertension is what range, and what do we do? So in normal, we say it is always less than 120 systolic and less than 80 diastolic. and we just encourage our patients in maintaining their pressures by telling them about the diet, telling them about exercises and other things that can help them actually minimize the acquiring of hypertension. So in this case, we don't give any treatment. We only advise them and encourage them to keep themselves at that normal pressures. Then when it is elevated is between 120 to 129 systolic, or it can be even more than 80, or it can be below 80, but it will still be not normal depending on the person's previous blood pressures. So someone can be having normal blood pressures, but when it comes, it still be at the normal ranges. But what we know is these pressures can keep increasing a bit by bit. Whenever it comes, you see it has increased. Another time it comes, it has increased. That is not normal. Then you just realize this person is tending into developing hypertension. So what do we do when there is elevated pressures? We actually try to also encourage our patients, and we give generally no treatment to also them. So we only try to tell them to do the exercises just like those in the normals, so that they can be able to sustain or to help their BPs come back to normal in case there has been some slight elevation. Then in stage 1, hypertension, this is basically when the systolic is 130 to 139, or the diastolic is between 80 to 89, or even it has reached to 90. And here we still encourage our patients on what to do and how they are able to actually reduce their pressures. So we talk about the lifestyles, and they should be able to modify their lifestyles. If they have been feeding on so many things of fats, they should reduce, and also taking a lot of salts, they should also reduce on the salts. So here, if risk is less than 10%, because we take history, we interact with our patients, so you can be able to tell how much risk does your patient have, what percentage do you think that he can actually get into danger. So you start with health lifestyle recommendations by telling him what is expected to do, what is expected to feed on, and so forth. So if greater than 10%, start the drug therapy with one of the following agents: ACEI, and that is angiotensin converting enzyme inhibitor, and then also we can give them the angiotensin receptor blockers, or we can give them calcium channel blockers, and also the diuretics. This will help in the management of hypertension. Then in stage 2 hypertension, the BPs for the systolic will be more than or equals to 140, and then the diastolic can be more than or equals to 90. So we also need to encourage them, we also need to counsel them on the lifestyle. How are they supposed to lead their lives, depending on the feeding and the rest of the things. Even drinking, we have to talk about it. So when they tell you about their lifestyle, that's when you can be able to actually pick up what you're going to counsel them on. So 2 first line drug combinations can be given from the different classes. So you can decide to say that, let me give this patient maybe angiotensin converting enzyme inhibitor. You combine it with maybe calcium channel blockers, or you can say, let me give angiotensin receptor blockers, combining it with maybe ACEI. So you can decide to combine either 2 classes to help your patient actually cope up with his pressures. So individuals with SBP and DBP in 2 categories should be designed to the higher BP category. So you have to look at this, and then as your patients are presenting to you, you have to also use your own understanding and also the signs and symptoms the patient is presenting. The complaints and the history of the patient will help you in categorizing and seeing what kind of drugs do you need to give to this client. So in every condition or in every disease, there is always a cause. So the causes of hypertension can be classified based on what could have predisposed the patient to getting hypertension. So one of them is essential, which is idiopathic or primary hypertension, and this one it's 90% of the cause of the hypertension. Hypertension is not known, the cause is not known. People get hypertension, but they may not be able even to explain how they have actually acquired the hypertension. So our patients, when you talk to them, you can be able to identify that this cause is either essential, idiopathic, or primary hypertension, meaning the patient does not know, or you may not be able to tell the actual cause of the hypertension of your client. Then a secondary hypertension, 10% of the cases due to identifiable underlying causes such as kidney disease, hormonal disorders, and certain medications. So here you can be able to tell that is now in the secondary hypertension. And then in the essential hypertension, that one the cause is actually not known, and it is primary hypertension, whereby they are basically more than 50%, and they say 90% of these people with hypertension, they do not know the cause of the hypertension. But out of the secondary hypertension, 10% of these cases, they can always identify the cause. And they gave examples that the kidney diseases can be one of them. The hormonal disorders can also be one of them. And certain medications can also cause increased high blood pressures or hypertension in our patients. So let's talk about each of them. Here, the primary hypertension, they say it accounts for around 90% of the cases of hypertension, and then it is not identifiable. It does not have any underlying cause. Then it is linked to genetic, lifestyle, and environmental factors. So most of our patients who have primary hypertension can be due to genetic, because hypertension is one of the chronic conditions that can be transmitted by genes. So when someone in a family has hypertension, it's likely that even the other people who are of the same family, or who are of the same maybe father, mother, can have the same condition. So it can be genetical, it can be the lifestyle of an individual, the foods that we eat and the way we lead our lives can predispose us. Even environmental factors can contribute, like stress and so forth. Then manage it through lifestyle changes. That's how we can manage the primary hypertension. If you see that somebody eats those kind of foods which are actually predisposing them to production of maybe let me say low lipids, which can go and accumulate in the blood vessels, causing actual occlusion or causing resistance in the blood vessels, then we advise them. If people do not do exercises, we encourage them to do exercises. Then also try to reduce stress in case they are stressed, and also the medication bit of it can be one of the ways we can manage our patients depending on this primary hypertension. Then for the case of secondary, we also manage it differently, though sometimes we can combine the use of drugs and also the lifestyle, depending on the lifestyle of your patient. So here, it arises due to another underlying medical condition. So there can be another condition that can predispose our patients to having a secondary hypertension. And when you look at this, having mentioned the different conditions above, we talked about the kidney conditions, renal failures, we talked about diabetes. Also, this can predispose our patients into secondary hypertension, and we get about 10% of such cases with this secondary hypertension, and it is due to identifiable underlying causes such as the kidney diseases, hormonal disorders, and certain medications which I've already tried to mention. And the treatment involves addressing the underlying cause. So the underlying cause, if it is kidney disease, then you have to treat the kidney disease. If it is because of the hormonal disorders, then you have to manage the hormonal disorders. If it is maybe drugs, then you have also to look into that, and you'll be able to handle the situation of your client. So what can be the risk factors for hypertension? There can be risk factors and there are also causes. So we finished to talk about the causes, so we need to also understand the risk factors. One of them is cigarette smoking. When a person smokes cigarettes, we very well know that in cigarette there is nicotine, and this nicotine can always predispose the constriction of the blood vessels and cause rigidity or resistance in the blood vessels, where there will be no proper elasticity during the passage of blood through these blood vessels, and therefore there will be increased pressures along the blood vessels, which will raise the blood pressure. Then also obesity. Obesity is one of them, and this obesity can predispose them to diabetes, and this can be the cause of hypertension. Then physical inabilities, dyslipidemias, and I talked about low lipids, which can go and accumulate along the blood vessels. And then also diabetes mellitus can be one of them, and this is one of the chronic conditions that moves along with hypertension. Most of the patients who have hypertension, when you check on them or when you take history, you realize they also have diabetes. Then microalbuminuria, or estimated glomerular filtration rate less than 60 mils per minute, and that one can be due to the kidney conditions. Then the age, older than 55 for men and 65 for women. So for the case of men, in case a man reaches about 55 years, he's always prone to have hypertension. But for the ladies, there's at least some difference of the age of around 10 years. If a woman reaches about 65, then she has a risk of also developing hypertension. And then family history, we've already talked about it. Premature cardiovascular diseases, men younger than the age of 55 can also develop that hypertension, though we're saying that for the case of the men, it is those above 55 years. But they say in family history, it can also be below 55 years. Then women at the age of 65 still. So you can see that, and you just know when someone presents with that, you can relate it to the age and the sex. So treatment of hypertension. How do we manage the hypertension? The primary goal of hypertension control is to reduce the risk of cardiovascular disease. So when we manage hypertension, we are reducing the conditions that can affect the heart. And we very well know when someone has high blood pressures, this will backfire, or this will cause an impact negatively to the heart and the blood vessels. That's why they call it cardiovascular diseases, because it affects both the heart and the blood vessels. Then guidelines recommend maintaining blood pressure below 130 over 80 millimeter mercury in adult patients. So they need to have this below. When it goes above this, then the patient will be actually prone to hypertension, or the patient has acquired when it is above this. They recommend it to be always sustained below this. Then for non-institutionalized ambulatory community dwelling patients age 65 and older, and then systolic blood pressure should be kept below 130 millimeter mercury. So you can look at this. If these patients are not admitted and they are always within the community, and when you look at it, the patients could be of the age of 65 years, their pressures should always be kept below 130. The moment they go above that, especially the systolic, then this patient is going to develop hypertension. You'll be able to join. So we're talking about treatment, and here we were saying clinical judgment. And in the clinical judgment, basically we look at the signs and symptoms. You'll see how the patient is presenting. Then also the patient preference also is one of the things that we need to consider when we are giving a treatment of hypertension. And also a team-based approach are necessary for decisions regarding treatment intensity and choice of antihypertensive drugs in older adults. So when we are giving treatment, we should not just give on our own without making consultations from our friends and our maybe the attendants and some other caretakers, or the patient himself. They have also to contribute, and they have to play a role when we are giving them treatment, because if you just give any treatment that you feel, then your patient may not adhere to the treatment treatment. So with hypertension and significant comorbidity and limited life expectancy, we really need to put into consideration that the patient has to make a choice, and also the relatives or the caretaker, so that they can give support, especially in relation to adherence. So I think we are stopping here, then we shall continue tomorrow in the 16th slide. All right. Are you getting me?
Yes, please.
I think we are stopping here in the 15th slide. Tomorrow we shall start from the 16th.
All right. Thank you.
Mm.